Okay, good afternoon, everyone. Shortly, I will lay down an amendment to repeal Obamacare. We pledged to the American people that we would seek to repeal this 2,700-page bill that seeks to restructure all of American health care and put the decisions in Washington. I'm pleased to announce that all 47 of my members will be voting to repeal Obamacare. And I want to call today on several senators who can give you the impact of the bill on several different sectors of our economy. I'm going to call first on Senator Ron Johnson, who used to run a business, to talk about the impact of Obamacare on jobs and the ability to expand employment. And then I'm going to call on Dr. Barrasso and Dr. Coburn to make additional comments about the impact of this new health care bill on the quality of American health care. So with that, let me call on Ron Johnson.
Well, thank you, Leader McConnell. I do bring the perspective as a business person who's been running a manufacturing plant for the last 31 years. And I think the point I've been trying to make is, as a manufacturer, you learn to look for the root cause, not the mere symptoms of the problem. To me, sluggish job creation, a slow economy, high deficits are the symptoms of the problem, not the root cause. It's the size, scope, and cost of government that are the root cause, hampering job creation. And to me, Exhibit A of large government, out-of-control government, intrusive government is a health care bill. That's why I totally support the repeal of that. I believe that once we do that, it'll help remove uncertainty from this economy, and it will help job creation. Thank you.
Well, if you saw the latest Thomson Reuters poll of physicians, what you find is 2/3 of the physicians in this country think that this is going to be disastrous for care in the country, for them and their patients. 80% of them think it's going to result in lower care for patients, while it doesn't do anything it costs. If you look at the Independent Payment Advisory Board numbers, the only people who have any control over that is Congress. You can't sue in court, you can't stop it administratively. So what the actuaries for Medicare have said, that for us to solve the problems, the reimbursement for providers in Medicare will actually be lower than it is for Medicaid today under the guise of this bill. And then the final point I would make is the recent study that came out that said if you didn't have Medicaid, which 18 million new people are going to have Medicaid, and you went to the ER with the same diagnosis, that your health care would actually be better having no insurance at all than having been placed in Medicare. So the answer to our problems is not continue to put people in a substandard system, but to let the markets work so that we can actually give people the care that they want. Finally, this interjects in between the patient and the physician in terms of what the care is going to be. The most personal of things in our lives, we're going to have the federal government intervening in that process. That's rejected by 80% of the physicians and 75% of the patients in this country.
There was a court ruling, as you know, yesterday in Florida after the ruling in Virginia. To me, this is a second stake in the heart of Obamacare. The president at the State of the Union said he was looking for those of us to come forward with ideas to how to increase quality and decrease the cost of care. We continue to come up with those ideas and bring them to the president. These are ideas he has rejected in the past. What I want as a doctor for my patients, what Dr. Coburn and others want is, we want patients to be able to get the care they need from the doctor that they want at a cost they can afford. The president made a lot of promises about bringing down the cost of care. The American people know that those promises have turned out to be false. This is adding to the cost of care and adding to the cost of business. It is much more expensive now to hire someone, and we want to make it cheaper and easier to create new private sector jobs. This health care law makes it tougher and more expensive to create new private sector jobs. I talk to patients, I talk to physicians. This is a bill that is bad for patients. It's bad for providers, the nurses and the doctors and the physician assistants who take care of those patients, and it is bad for taxpayers. And that's why today, with one poll that just came out, 58% of Americans still want this health care law repealed. And when they actually do the breakdown of the polls of asking people who've talked to a doctor or a nurse or a physician assistant, those numbers of people who want it repealed go up. And yet just this past week, the Secretary of Health and Human Services added another 500 waivers, people that are no longer having to live under Obamacare. Of those waivers, we now have over 2.2 million people receiving waivers from the mandates of Obamacare. Only 7% of the private sector workforce in this country is union members, but yet they have 40% of all of the waivers. These are the people that lobbied and spent significant amounts of money to get this law passed. If this is such a good bill, why do they want out? And that's why I want every American to have a waiver and to be out of this Obamacare law, and that's why I'm going to vote to repeal and replace Obamacare.
We'll take a couple of questions if there are any. Ken? Yeah, we don't have an agreement on the manner in which we'll have a vote, but everybody will have an opportunity to be on record. And I think it'll be clear who is for repeal and who isn't. Look, I think with regard to what's going on in the Middle East, my view is America ought to speak with one voice, and we have one president and one Secretary of State, and I think they ought to speak for America with regard to the crisis in the Middle East. I was just informed about you. Thank you. Look, I think we're all watching with great interest. We all know Egypt is, by almost any measurement, the most important Arab country. We care a great deal about how this ends, and we hope that at the end of the day, we'll still have a strong ally in the government of Egypt. Have any effect on what? Well, we had already promised the American people that we would, as early as possible, vote on repealing Obamacare. The House has already done it, and while I thought the court decision was significant and further indication that the bill not only has trouble in Congress but trouble in the courts, we would have moved ahead in any event.
Mr. Leader, there are some Republicans in the House who want to abolish the Appalachian Regional Commission. Is that something you can support?
We're going to be looking at every conceivable way to reduce spending. In the last 2 years, we've added $3 trillion to the national debt while we've lost 3 million jobs. So I think the view of most Republicans is that nothing is off limits, and we're anxious to reduce spending. And I would go one step further and say we're also anxious to do something about our long-term unfunded liabilities, which are enormous. And I hope the President will decide he wants to work with us on that as well. Thank you.